So we initially started off with the base. We started off with the gut. We went to hormones. We went to methylation. We went to the mitochondria. And post-lunch, we have learned how to make our personalized longevity stack. Okay, this was all the base. And I wanted it, we always say the foundation needs to be strong. So right now, with a strong foundation, now we're going to talk about the future of longevity. Okay, the future of longevity comprises of advanced concepts, and you're going to learn some advanced stuff, which is going to be in the rest of the sessions. And I'm pretty sure you're going to enjoy it. Or approach the sessions with an open mind. You will have a lot to learn. There'll be many things you might feel, oh, wow, oh, I don't know about this, or something like that. But yes, the first thing, the first secret from the future of longevity is the small little messenger molecules called peptides. And to explain about peptides is a person who is extremely passionate about peptides. And even last time, when we had our conference, people kept on asking about, okay, can you give us an explanation about the peptides, a little more detail about it? You are going to get that now. So please welcome Dr. Ashwini Garg again on the stage, who is extremely passionate about peptides. We'll be teaching you how to use peptides for longevity. Put your hands together for Dr. Garg. Thank you, thank you.
Thank you so much. So it's one of my favorite topics because I work with autism, and when the problem is more tougher, then you need more aggressive tools, even though they're simplest molecules, but they're aggressive in terms of repair regeneration. So when it comes to longevity, also repair regeneration is the key. If we keep repairing ourselves faster, probably disease will not come as much it is coming now, or at least we can keep our biology more healthier as we age. Just before we get into peptides, the basics is, as we age, we lose stem cells. We don't repair, regenerate as much. I mean, there are a lot of theories around it. One of them is that there's a DNA damage, there's gene expression errors, mitochondria is not great, microbiome is not great. So another theory is we start accumulating more damaged DNA. So that's another one. So as we age, our repair regeneration, our cell quality becomes bad. Mitochondrial quality becomes bad. That's also one of the reasons of aging. Now, here comes a man who has developed this bioregulatory peptide. His name is Dr. Vladimir Kavinson. He was the personal doctor to President Putin. So this guy has spent almost 4 decades in figuring out these peptides. So very, very potent stuff. And as per him, aging theory means as we age, we lose the ability to produce these peptides. So it's as simple as that. Peptide means every organ system in the body, your gut, your liver, your thyroid gland, all of them will make its own peptides for repair and regeneration. So as we age, probably amount of peptide that is required for each of the organ repair regeneration becomes low. Thereby we have hypothyroidism, we have low liver function, low gut function, hormones becomes bad. So if we do something about bringing these peptides into our system through some route, we can maintain our health, we can maintain our longevity. This is where it is. So peptide bioregulator regulates organs impaired by aging, disease, or trauma. Okay, even if there's a trauma, there's a physical trauma to the body, then also these peptides can help to bring back our health. So this is the potent stuff. Now, recently I learned about something called cell danger response. Now, because of, let's say, I'm stressed, I have toxins, I have infections, my cells will get into a more hibernation state. Even though I have removed the toxicities, I have removed the traumas, things like that, still body might not get into repair regeneration. Even for that, if we use some of the peptides, maybe we can bring the cell out of the danger response. So this is where also peptides are very, very potent. In regenerative medicine, they're primarily cell therapy, which is stem cells, various forms, and peptide is one very, very potent, which is easy to implement, easy to use. Clinically, we can make use of it. So peptides, insulin is also peptide that we use into clinical practice, but these peptides are more specific in action. More comes for repair and regeneration. Typically, 2 to 5 amino acids. Some peptides could be a little longer. But usually bioregulated peptides will be 2 to 4 amino acids. So they go in the body, they go into the cell, they act on the DNA. So they can bring a epigenetic change. So another thing is they are not like paracetamol. Paracetamol is something foreign to our biology. Antibiotics something foreign to the biology. Peptides are something which is there in our body, just like a supplement. Vitamin C is required, vitamin D is required. Similar to that, peptides are something which body understands, body produces it. As we age or disease, things like that, maybe we don't have enough of it, and we bring them in, it does the work. So basically, help restore organ function. My thyroid is not doing okay, my liver is not doing okay, my kidney not doing okay, I can do something about it. I don't have to always think, I am stage 4 kidney disease, it'll go to 4 or 5, and eventually I have to go dialysis. Maybe I can do something, bring back the kidney function from stage 4 to 3 and 2 and 1, and maybe all right. So this is the potent stuff. So they are targeted molecules designed to specific receptor or pathways related to aging, regeneration, immune function. They're biological active, and the good part is they are low immunogenicity. Most times, if you take a peptide, either it'll do something for you, or it's a miss. It might not cause a reaction. Let's say we overload paracetamol, we will kill our liver in some ways. But peptides are fairly in that way low immunogenicity. So very, very safe molecules also. And they're always multifunctional. They help your immune system, they help your repair regeneration, they help your organ function. So, and this is some of the ways. They help in cellular signaling and modulation. They can regulate gene expression. They can activate stem cells also, thereby regeneration can happen. They can modulate immune system also. Now, you see after COVID vaccines or COVID infections, infection or injection, people are getting a lot of autoimmune problems. And your immune system has become dysregulated, and a lot of people dying like flies. And one of the reasons, as per some of the very good doctors, is our immune system is dysregulated. And these peptides can help bring regulation to the immune system again. So great stuff. And we have been talking about mitochondria as we age. Till the age of 22, we grow this mitochondrial number into our cells. As we go from 22 to any age, we lose the mitochondria. This is aging. This is biological aging. This is how it is, right? But these peptides can help to in the biogenesis of the mitochondria also. So they can help with your brain health. They can help you with your type 2, 1.5 diabetes, things like that. So very, very powerful stuff. So now, when it comes to the clinical use of the peptides, okay? So there's something called master peptide, which is, looks at all systems of the body. One of them is called pineal gland epithelion. Then you need to have a good regulated immune system. If you have autoimmunity or a weaker immune system, then also, problems will keep coming back. So immune peptide is a very potent one. Then you need a good healthy digestion, and your gut should not be leaky, right? So a peptide which can help sealing your gut, so that could be a gut peptide, a leaky gut repair peptide. Then you need something to improve your mitochondria. So some peptides can help the mitochondria, so they are the foundational peptides. Then you need a healthier brain, healthier nervous system. So certain peptides can make the brain healthy. And of course, you need a good blood supply. You need a healthy vasculature and blood vessel peptides. Then something on the hormones where, ovarian peptide, testicular peptide to keep the hormones up. So these are the foundational peptides, and this science is exploding. So many options available when you have to start as a, we all has to start as a beginner. These are key peptide. If we put into practice, then we can help a lot of our patients. So epithalon, which a pineal peptide, we call it a master peptide or anti-aging peptide. It can improve a telomere length. So in the anti-aging world, we measure this telomere length, and if it is reducing, probably we are aging faster. If it is not reducing so fast. So this is where this peptide can be useful. It can help increase physical performance. The strength of the body can be increased with this. It enhances mental clarity. It improves the sleep quality. It helps to produce melatonin. The melatonin will help you with the sleep quality. Melatonin will also help your mitochondria. So indirectly, this single peptide doing a lot of functions. It helps your immune system, which is the key thing for us. It helps you regulate your immune system also. Of course, sometimes skin health, more on the anti-aging part, more on the superficial thing. This is where also this is very potent. It is also good for the hair growth. So hairs are very, very good for, we all want healthy hairs, and this peptide can also help with this. Eye health, of course. So a key master peptide. Another very, very key master peptide is called BPC-157. It promotes tissue repair, angiogenesis, reduces inflammation, and it also does stem cell recruitment. For example, if somebody has an accident and they underwent a surgery and we want a faster recovery, if we put this peptide around that area where the injury has happened, the clinical outcome will be faster than usual. Let's say somebody after a bone fracture, they'll take 3 to 4 weeks for them to get on the feet. This peptide maybe reduced the whole journey by 1 week. So this is that potent because it is recruiting more stem cells and helping in that area. So that makes it very, very potent. We use in a lot of colitis, IBD cases. The people are bleeding from the gut. So we use this peptide to help repair the gut faster. So very, very potent in there. A lot of people have food allergies because they have infections causing leaky gut causing a lot of food allergies. So this peptide can help to see the leaky gut, thereby undigested food will not go to the bloodstream, thereby we can reduce those food allergies also. It is anti-inflammatory, of course. So a lot of us have this inflammatory problems. Thyroid is Hashimoto's. You have psoriasis, rheumatoid, things like that. So all the autoimmunity things also this peptide can help. But more in the repair and regeneration, but also strengthening the immune system. It is also cardioprotective, which is, I think, either infection or injection, we need something. So this helps us. It also helps to regulate your growth hormone. That's also a great thing. Similar to BPC-157, there's another one which is called thymosin beta-4, which is thymus gland peptide, which is for immune balance, but it also has more repair regenerative properties. It promotes cell migration, it leads to angiogenesis, it leads to tissue repair, stem cell activation, muscle repair, nerve fiber repair also. So this is again a very, very potent stuff. You can use it for cardiovascular, wound healing, muscle repair. So a lot of time people in the gym world, they get these muscle injuries or tendon injuries. So you can use this peptide to have a faster repair. And we don't have to suffer from lingering injuries of the So now autoimmunity is a key problem that a lot of, at least into our practice, Hashimoto's, psoriasis, IBD, and of course autism also, one component of autism is autoimmunity affecting the brain. This is where we need a healthy, strengthened immune system. A lot of people with autoimmunity, they have a weakened immune system. It's a dysregulated, weakened immune system. So we want an immune system which is regulated and it's strong enough to fight what we want to fight. So this is where the alpha-1. So I have to help somebody with hypothyroidism, for example. Their T4 is low. And one of the reasons of their hypothyroidism could be Hashimoto's. So before I can fix their hypothyroidism, I have to ensure their immune system is good. immune system regulated, then I can work on a thyroid, use a thyroid peptide to improve the thyroid output also, along the nutrition things. What basics has to be always done, but this peptide can help me balance the immune system. Thereby, it modulates an innate immune system. It promotes T cell differentiation. It also helps to make antibodies. So a lot of time in the last few years, we have seen people have taken the injections, but they still got the infection. One of the reason is your immune system is weak. You can put a trigger, but if your immune system is weak, it might not make the antibodies. So for an injection to work for you and make antibodies and fight the possible infection, if at all the cases, you need a strengthened immune system. A weak immune system, you put vaccines probably is not be useful. So it can help autoimmune disease modulation. Okay, so autoimmunity, if we have to work with, thymosin alpha-1 is one player. Of course, diet, lifestyle, leaky gut repair, dysbiosis, mitochondria, all that has to be done. Along with that, if we do that, it's fantastic. And sometimes one of our doctor friend, he's into critical care, he was asking, can we use something for the infections? So thymosin alpha-1, I think it is liver infections, viral liver infections, thymosin alpha-1 is an approved drug. So we can use it. MOTS is another very, very powerful peptide, which is one of the key component. It causes biogenesis of the mitochondria. So when you have a healthier mitochondria, you have enough numbers, strong mitochondria, your system becomes more sensitive to insulin. When you have better insulin sensitivity, you can lose weight, you have better exercise performance, you have better brain clarity. Of course, mitochondria is good, then means anti-aging. Your heart can pump better, your vessels are better. Your muscle. So mitochondria is the key in almost all organ systems, right? So you want a healthy body, healthy organ system, you need good mitochondria. This is where, and there is data also, people with after COVID vaccine, infection or vaccine both, they have a lowered amount of MOTS in their body. So in those cases also, this can help help our mitochondria. Another peptide which is great for mitochondria is SS31. It enhances electron transport chain efficiency. Thereby, efficiency within the mitochondria gets better. So it promotes mitochondrial repair. Thus, it also has an antioxidant energy metabolism. As your mitochondria gets better, your machinery gets better, your engines get better. Then you put in the fuel, you eat in the fuel and it turns into energy. So a lot of time type 2 diabetes means your engines are weak, you put in more fuel, they float into the blood and blood sugars goes high. So type 2 diabetes is purely a metabolic disorder, mitochondrial disorder. So this peptide can help you come out of type 2 diabetes. As mitochondria gets better, of course, neuroprotection, cardioprotection, anti-aging, things like that. So ultimately, that is where the goal is, if we make somehow the mitochondria more better. So this is, so now, okay, peptides, typically there are 3 forms available. One form is you take an organ, a gland, dry it, crush into a capsule. For example, you take a young animal thyroid gland. So it's a dry animal, young animal gland, which has the hormones into it. Also, it has the peptides, which is there for the animal to repair, regenerate of their own organ system. But we can use that. So that's one. Second possibility is you can take the active molecules out of the organ system and then you capsulate it. Third way is you can have something similar made in the lab. So far what I talked about is more like lab-made biosimilars which are there in the body but making in the lab. This is something which is coming from an animal source. For example, a young animal heart is taken, out of that bioactive molecules are put into the capsule. So this is a powerful, which is good for the blood vessels, but which is good for your heart functioning. So prevention of cardiovascular disease, coronary artery disease. It is good for arterial hypertension. It can be useful for myocarditis. Basically, it brings a balance to that organ system. Okay, if it is, let's say, if we are dealing with hypothyroidism, this peptide can help. The thyroid peptide can help with the improving the gland function. If somebody is dealing with hyperthyroidism, then also this bioregulatory thyroid peptides can bring in the balance, and thereby hyper becomes normal. So this is the potency of these peptides. They always try to bring balance to the system. They don't push to this side or that side. So this is your cardiovascular peptide. Pancreatic peptide is another one, which is, and I'm trying on 1.5 diabetes. I'm trying on type 1 diabetes. Hopefully this will help regain some beta cell function. So a lot of time what happens, somebody is diabetic for a long time, they start with metformin, then they start with glimepiride, and there comes a time when we have beta cell exhaustion. Over a period of time we use these drugs and squeeze out more insulin out of the pancreas, and we don't have enough insulin coming out. So this is where probably this peptide can help to repair that organ and hopefully improve the insulin requirement. So it can be used in chronic pancreatitis to improve the glucose tolerance, can be used in type 2 diabetes. I mean, for type 2 diabetes, I would not use a peptide because these are expensive molecules. But for 1.5 diabetes, I'm trying on a few patients and hopeful that I will be able to make, somebody's pancreas is, let's say, 50% working, we can make it 70% or 80%, and then they can be off the drugs. Thyroid peptide, of course, thyroid conditions are, a lot of people are on thyroxine drugs. Sometimes they need, sometimes they don't need, but because TSH is high, they are put on the drug. You have to look at your T4. If your T4 is low, then you are right candidate for any drug. If your T4 is more than 8, why do you need it in the first place? That's one. But then if actually your T4 is less than 6, less than 8, maybe you are a right case for a thyroxine hormone replacement. But then how do we improve our own gland? Right? That is where the key is. So if we take enough nutrition, we have good exercise, we are stress-free, we're getting a lot of sunlight, if still your T4 doesn't go up, then this peptide can help you repair the gland. So this is a potent peptide. Both works with hypothyroidism, also hyperthyroidism. So quite powerful. Another one is liver peptide. Now, liver, this is another common thing. A lot of people, we eat a lot of sugar, and sugar feeds our microbiome. This microbiome will lead to something called auto-brewery syndrome. Auto-brewery syndrome will make a lot of alcohol into our body. So without drinking that alcohol, this is called non-alcoholic fatty liver. Without drinking alcohol, we are making our own alcohol, which is affecting the liver. So we are getting into this liver, fatty liver, cirrhosis, fibrosis, things like that. So this is where probably we heal the gut, we make our immune system better, and then we use a liver peptide potentially to recover the health of the liver also. Oh, it's 5 minutes. So another one is a kidney peptide. So one of my aunt, she has stage 5 kidney disease. I have been working with her for 1 year now. When she came to me, she needed diuretics, her body was swollen, her serum creat was 3.4, in a bad shape. And antihypertensive drugs were going on. It's like the next step to dialysis and next step to kidney transplant, if at all that happens. And after transplant also, we don't buy a lot of time, which is a reality. But now it's been 1 year. We have been using diet, lifestyle, stem cells, peptides. Now her serum creat is 2. Her EGFR has raised from 18 to 27. We are constantly monitoring it. She don't have any swelling. She don't need any diuretics. She's not on any antihypertensive drugs also. So fairly a decent life she is living. Yes, it's not that maybe a stage 5 is moving towards stage 4, but still she has a kidney problem. But it's been a year from a downhill to a stable situation. So of course, we have to constantly support our body with a lot of nutrition, things like that. But a downhill thing is stabilized. And we are hopeful now from EGFR of 17, it has come to 27. Maybe we'll make it to 50, probably at a good level. So a kidney peptide can be useful for chronic kidney diseases. And for your gonads, you have this Actiman Plus, which is to increase your libido, things like that. And it can improve your testosterone. Zinc carnosine is something Rashi just spoke about. It's a beautiful peptide, which a lot of people have this gastric ulcers. They never go. And most of the time, they're put on antacids for life. They never go. This carnosine is a peptide which can help repair the mucosal lining. So it can be used for gastric ulcer. It can be used for your IBD situations. Along with that, the beauty outcomes, it enhances collagen synthesis. It improves your immune system. It improves your skin elasticity. So along with the real medical outcomes, it also does anti-aging stuff. So that's pretty much on, simple talk on peptides. But this is a very upcoming world. Peptide science is increasing, and they say a lot of the medicine will move towards peptides. So learn about it and slowly start putting them into your practice one by one. I'm sure you will have greater outcomes in your patients. Thank you.